Okay, so बच्चे, this gets us to our next topic in neoplasia, that is paraneoplastic syndromes. This gets us to our next topic. Our next topic in neoplasia, that is paraneoplastic syndromes. What do I mean by paraneoplastic syndrome? इसका मतलब क्या है? Paraneoplastic syndromes. Paraneoplastic syndromes. These are symptoms. These are symptoms associated with a tumor. These are symptoms associated with a tumor which cannot be explained. Which cannot be explained either by metastasis. These are symptoms. These are symptoms associated with a tumor which cannot be explained. Which cannot be explained either by metastasis. Either by metastasis or secretion of hormones indigenous to the site, or secretion of hormones, or secretion of hormones indigenous to the site, secretion of hormones indigenous to the site. इसका मतलब क्या है? What does this mean? Symptoms associated with a tumor is causing some symptoms in the body which cannot be explained by metastasis. Suppose a patient has breast cancer which has metastasized to the liver. Breast cancer liver में गया, in turn leading to jaundice. Is this jaundice paraneoplastic syndrome? No. I can explain this jaundice by metastasis of breast cancer to the liver. I can explain it by metastasis now. So this is not a paraneoplastic syndrome. Symptoms which cannot be explained by metastasis or secretion of hormones indigenous to the site. Suppose the patient has parathyroid carcinoma, which secretes parathyroid hormone, which in turn causes hypercalcemia. अब खुद सोचो, पैराथायरॉयड कार्सिनोमा का तो जॉब ही है ना टू सिक्रीट पैराथायरॉयड हार्मोन व्हिच विल कॉज हाइपरकैल्सीमिया. इज दिस हाइपरकैल्सीमिया paraneoplastic syndrome with parathyroid carcinoma? No. Suppose a patient has insulinoma, which leads to increased insulin secretion, which causes hypoglycemia. Is this hypoglycemia paraneoplastic? No. I can explain this hypoglycemia on the basis of secretion of insulin from insulinoma. So it should not be associated with secretion of hormones indigenous to the site. This is paraneoplastic syndrome. Example, lung cancer. Suppose a patient has lung cancer which starts secreting parathyroid hormone leading to hypercalcemia. This hypercalcemia associated with lung cancer is paraneoplastic. क्योंकि parathyroid hormone, the normal site of secretion is not lung, so it is not indigenous to the site. That is paraneoplastic syndrome. So this is what we mean by paraneoplastic syndromes. Symptoms associated with a tumor which cannot be explained by metastasis or secretion of hormones indigenous to the site. Next point. Before we make the list of paraneoplastic syndromes with lung cancer, before we go to lung cancer, which is overall the most common paraneoplastic syndrome. Overall most common paraneoplastic syndrome is hypercalcemia, increased calcium levels. Most common paraneoplastic syndrome is hypercalcemia. Overall in the body, it is hypercalcemia occurring due to secretion of parathyroid hormone related peptide, occurring due to the secretion of, occurring because of PTHRP, because of parathyroid hormone related peptide, because of PTHRP. Next point, most common paraneoplastic endocrinopathy. Most common paraneoplastic endocrinopathy, that is which is the endocrine problem associated with paraneoplastic syndrome. Most common paraneoplastic endocrinopathy. Paraneoplastic endocrinopathy is Cushing's syndrome. Most common paraneoplastic endocrinopathy is Cushing's syndrome. ACTH, Cushing's syndrome. Next point. Let us first start with paraneoplastic syndromes associated with lung cancer. Let us first start with lung cancer. Let us first start with lung cancer. Lung cancer, whenever we talk of lung cancer, three main cancers come to our mind: squamous cell carcinoma, small cell carcinoma, and adenocarcinoma. Squamous, small cell, and adeno. Fourth type is large cell carcinoma. So, squamous, small cell, adeno, and large cell carcinoma. First point, most common lung cancer associated with paraneoplastic syndromes. Most common lung cancer associated with paraneoplastic syndrome. Out of these four, squamous, small cell, adeno, and large cell, which is the most common lung cancer with paraneoplastic syndromes? That is small cell carcinoma lung. That is small cell carcinoma. Small cell carcinoma lung. Most common lung cancer with paraneoplastic syndromes, small cell carcinoma lung. Next point. So let us make a master table of hormones secreted and clinical features associated with lung cancer. Hormones secreted and clinical features associated. Starting with the first hormone, that is ADH, antidiuretic hormone. Antidiuretic hormone. Increased ADH in turn leads to SIAD. If ADH increases, it in turn leads to SIAD, that is syndrome of inappropriate ADH secretion. SIAD, that is syndrome of inappropriate ADH secretion. It causes SIAD. What is the role of ADH in the body? Absorption of water. अगर ADH secretion बढ़ रहा है, syndrome of inappropriate ADH secretion, it in turn causes hyponatremia. There is more absorption of water, na? In turn reducing the sodium levels in the blood. It in turn causes hyponatremia. Next is secretion of PTHRP, secretion of parathyroid hormone related peptide. PTHRP, parathyroid hormone related peptide, which causes hypercalcemia. Please note, hypercalcemia is a paraneoplastic syndrome with lung cancer, not with parathyroid carcinoma. It is a paraneoplastic syndrome with lung cancer. Hypercalcemia. Next is secretion of calcitonin. Which is associated with hypocalcemia. So, lung carcinoma can be associated with both hypercalcemia as well as hypocalcemia, which are the paraneoplastic syndromes with lung cancer. PTHRP secretion, hypercalcemia; calcitonin secretion, hypocalcemia. Next is ACTH secretion. ACTH, which is associated with development of Cushing syndrome. ACTH, which is associated with Cushing syndrome. And lastly is gonadotropin secretion. Gonadotropins, gonadotropins lead to gynecomastia, enlarged male breast, gynecomastia. These are the paraneoplastic syndromes associated with lung cancer. Which was the most common lung cancer with paraneoplastic syndrome? Most common lung cancer कौन सा था? Small cell carcinoma lung. Which is the most common paraneoplastic syndrome with small cell carcinoma? Small cell carcinoma के साथ most common कौन सा है? SIAD. So let us write this. Most common paraneoplastic syndrome. Most common paraneoplastic syndrome with small cell carcinoma lung. Most common paraneoplastic syndrome with small cell carcinoma lung is SIAD, syndrome of inappropriate ADH secretion, which in turn leads to hyponatremia. It is SIAD, which in turn leads to hyponatremia. Most common paraneoplastic syndrome with squamous cell carcinoma lung. Squamous cell carcinoma lung is secretion of PTHRP, parathyroid hormone related peptide, which causes hypercalcemia. Which causes hypercalcemia. And lastly, most common paraneoplastic syndrome with large cell carcinoma lung. With large cell carcinoma, in large cell carcinoma, everything is large. So it is associated with secretion of gonadotropins. Gonadotropins in turn leading to gynecomastia. In turn